Dear friends, I think the biggest innovation of the 21st century is the intersection of healthcare industry and the technology. The new era has already begun. This is the fourth industrial revolution has been rightly coined. And if we go back to history, we'll see that certain revolutions have changed the mankind, their quality of life. In 17th century, we had the steam engine that changed the lifestyle of people. Then we had, in the 19th century, we had the automobile revolution. Then we had the internet, smartphones that totally changed the perception of the disease. And now we have the fourth industrial revolution, the intersection of healthcare industry and the digital health. And the biggest change which is happening across the world is that this technology is going to empower the mankind. Now everything has become customer centric. Moreover, because of different aging populations across the globe, increasing medical cost, difficult geographical terrain, it has become a necessity to go digitally and track and manage these patients outside the care of doctor's practice. Use of telehealth has already shown to address the obstinate shortage of healthcare system. The convenience of various technologies such as mobile phones, sensors, cloud computing, genomics, imaging, all put together with a standard medical promise to revolutionize the healthcare system. Eric Topol is one of the pioneer in uh, digital health, and he defines the digital health is the ability to digitalize human beings through a variety of means such as sequencing, sensors, imaging, fully exploring the digital infrastructure and ever increasing bandwidth, connectivity, social networking, and healthcare information system in his innovative ways. So it is basically digitalizing the whole healthcare through connecting all these dots. And Dr. Topol believes that we are ending an era of medical information asymmetry. Now, with the evolution of seamless digital techniques, affordable techniques, it's possible to have a symmetry or a standardized method of percolating these informations to the last mile. And the best part of it that this technology is affordable, the cost of digital health has significantly come down, and has been rightly said by Dr. Leroy Hood, who is another pioneer in system biology and bioinformatics. He said he created a term called P4, which stands for predictive, preventive, personalized, and participatory medicine. So he said this P4 is going to change the whole world. He believes the medicine is undergoing a major revolution that will transform the nature of the healthcare from being less reactive to more preventive. And there are different ways, not only it enhances the quality of healthcare, but also it can increase the profitability. The era of digital transformations is not only upon us, it is already in full swing, accelerating a fast pace and reimaging in every aspect of lives. And it is really transforming the world in many ways. The best part of it, when you have very structured, modular digital information system, it can increase the productivity. Business digitalization allows you to better evaluate all productive processes, analyze intensely each and every step. So the quality control, the validation, and this becomes easier. Digitalization of documents provides a lot of time and space to give the optimization of the resources and streaming up the production. So first of all, it can become very seamless, and it becomes very uh, you know very professional and very effective. The second part is that the customer order management. Digitalization customer orders and managing them can enhance profitability in the business, because this will ensure that you don't miss any order, or if there is any loophole in the system or any employee is not working inefficiently. So customer management program converging all operations through a digital platform will give you the ability to intelligently put information into context that can drive insights. So the customer management order also becomes very effective, and that you will be able to make the right decision regarding your business. So it will help you to provide speedy customer service by giving the visibility you need to promptly answer customer queries regarding with their orders will be produced and shipped. Digitalization also means a lot of lean inventory management system. This will have an accurate knowledge of raw materials and finished good products. Will have a lot of accurate information regarding in terms of conditions, revenue, detailing, and all those things. So it can do a lot of cost curtailing, and at the same time, it can make very efficient. So that instead of becoming doctor centric, you become much more customer centric. Another very important thing is that it can facilitate internal process integration. So uh, different teams are busy doing their work, but when information from one entity is needed and back over, there's a lot of handle. So what can happen? This is like for example, there are different departments are coming, different specialities are coming. So all these components can be integrated in a much more better way digitally, so that there is an understanding of the patient as a whole and allows the business systematization organization. The process increases consistent the work output. So what happens normally when you work in an organization or center, there is a lot of asymmetry, or there's a what you call disintegration of the information system. So it can enhance or facilitate internal process integration. And of course, it can give you a lot of open opportunities, and before a lot of for example, a lot of expanding through e-commerce and all. You give customers a lot of offers and tools, so that there are a lot of open possibilities of enhancing the system. So, and and the best part of it, that when you bring digitalization, you bring a continuity in care. So you come to know your patients, their data, their connectivity, and it's more of holistic in that approach. So you can connect all the dots. You can understand the patient, their needs, and it can be a two-way connect. So they can always connect you whenever they require you. So everything becomes very organized, very systematic. And the best part of it, it's a very useful tool for knowledge dissemination. All these apps and methods and all come makes the dissemination of knowledge is very effective, because in a healthcare center what we need is a lot of effective patient education tools, image centric basis, so that the patient can be educated. This can be a lot of self learning. The doctors and the institutions can create certain apps and methods or something like a storytelling to make people understand the disease and give them a lot of tools so that they can monitor at home and all those things. So knowledge dissemination is very important, and that is, and digital tools are giving more holistic options through availability of data, giving patients control over their well-being. So that now it has, as I mentioned, that it become much more customer centric. So now the patients can monitor their own parameters more effectively. The tools help us to make better informed, give them new possibilities, timely diagnosis of disease, a lot of supervision, chronic techniques like outside the traditional health management and everything. It likes, as I mentioned, that the continuity in care, right treatment strategies, adherence to the treatment, preventive treatment. Uh, you know, it's a two-way connects. Monitoring and knowing where they're going wrong. So everything gets better coordinated. So digitalization makes it easier for patient healthcare to remain in the same page. And gone are the days when the patient had to maintain a thick medical records. You don't need all those thick medical records, particularly with the patient emergencies, patient history. And many times what happened whenever the patient land up with some acute emergencies, certain histories are not available. Maybe their right attendants are not available. So when you digitalize the record, so you get the right kind of access to the history, because every patient has a history, and history gives you a lot of information for the right treatment. As I mentioned, the patient inclusion and patient compliance, there was a time when healthcare was one-way conversation. Now it's become two-way. How the into a more retail-like business transaction with the new tweaks. Healthcare, there's a better mapping, as I mentioned, that so you can map the disease and best forward. And this has really created a lot of awareness. So now the people at large, even people, those who are not educated, through this right kind of dissemination tools, audio-based tools, image-based tools, the awareness level in the industry, awareness in the community has increased. And definitely, it has really helped in the long-term care. If you're a lucky survivor, you receive high-quality care from the nurses, doctors, while in the hospitals. When you're going to prepare home, with the support of the doctors have the clear situation. Because previously, once the patient gets discharged from the hospital, it becomes very difficult to monitor the patients. Now with these apps and techniques, one can modify the lifestyle monitoring, as I told you, the nutrition, the exercises and monitoring techniques all become very so it's very therapeutical. So digital technology has become very therapeutic. So digital therapeutics can be defined as an intervention that digitally delivered and has a therapeutic effect on the patient. So it's very therapeutic in the patients. So digital health can improve overall quality of life. Now, like common diseases like diabetes and other chronic respiratory diseases, lot of wearable gadgets are there which can monitor them, track the diseases, measure their sleep, record nutrition. So a lot of tools have come which can help you to increase their adherence and compliance to the treatment. So now this telehealth and video consultations are really very enhancing. There's a word about Ayushman Bharat, and Ayushman Bharat digital mission, I think, is a very interesting area. The sandbox was created part of mission that we lacked as a framework for technology and product testing will help organization, including private players, to be a part of the national digital. So this is the first time it's a PPP initiative. So the private players also can chip in, and they get one kind of platform for the dissemination. And there are a lot of benefits. The doctors and hospital healthcare, they can work together. So easy doing business, create an integrated system. There's an unified payment interface UPI in revolutioning the payments, and the data dissemination and everything. The equitable access to quality healthcare. So that has really made. So definitely the government is playing. Everybody is going to have a digital card. It's something like an Aadhaar card. So you can come to know the digital record. And all the platforms from private to the government to the institutions has become one page, so that the things become very effective and the data can be retrieved effectively. Yes, there are safety issues, but one has to do definite protective. Now we have encrypted data, a lot of new techniques and trusted organizations where you can really take care of the data. So there are a few challenges. One has to rectify those mistakes. So I think with the right kind of encryption and blockchain, what do you call it, so we can really address those safety issues in digitalizing healthcare. Every new revolution has challenges, but if we can go very systematically, keeping those all possibilities with an open mind, I think this can be the future, and this is the future of the mankind. So this is my take. Regards, Dr. Bose, Senior Pulmonologist, Delhi, founder of SANS Foundation.